TV. Now, chances are you or someone you have loved has suffered from a stroke, or at minimum, you probably are at risk for one and you may not know it. So today we're going to raise your awareness around stroke, and joining us is Dr. Bhatia. He's the Assistant Professor of Neurology Clerkship and Co-Director at UMMC, and he knows all things stroke. So welcome.
Thank you so much, Rebecca, for having me.
And I think, as I'm putting my dietitian's hat on today here on Good Things, and I think this is something that needs to be talked about, because between the two, whether you have stroke and then obviously you have heart disease, or you could have a heart attack. I don't want either one of those, but I feel like stroke gets less awareness, right? We always talk about heart attack, but then we forget you've got this other really big thing that can happen and can have some major consequences if death isn't the consequence. So let's start with the simple question. What is a stroke?
Yeah, that's a very good question, actually. So, stroke is a medical emergency, actually. And the way we describe it is if a blood vessel in your brain gets blocked or gets ruptured, our brain tissue starts to die out, and it shows up in some specific symptoms. This is what technically a stroke is. In layman words, some people call it as brain attack, just as analogy to heart attack.
Oh, I've never heard that. That's a good one, though.
But that's what stroke is. Now, the most common ones are, of course, the clotting ones that we usually refer to. But there are bleeding kind of strokes, which are also a big proportion of that comes under the umbrella term of stroke.
So are there different kinds? And then I guess the most thing people are going to know is like what causes them, because everybody wants to stop it. And I can go ahead and tell you a lot of the things you don't want to hear because you've already heard it and you're not doing it, like your mama told you eat your fruits and vegetables. But there's some other causes to the different sort of kinds.
Yes. So like I said, the most common ones are the clotting ones, and they have traditionally been associated with the classical risk factors that we all talk about, more in the background of a heart attack, like blood pressure, cholesterol, diabetes, smoking, a heart rhythm disorder like atrial fibrillation. And they also have been associated with stroke in these in this setting. But the bleeding ones are actually more associated with blood pressure, high uncontrolled blood pressure for a long time. And there's a specific subset of the bleeding strokes which are related to the aneurysms. Aneurysms are nothing but just outpouchings in a blood vessel at a weaker point in the blood vessel. They just grow with time, and then with the long-standing uncontrolled blood pressure, they just rupture and bleed and damage that part of the brain. So that's another specific kind of a bleeding stroke.
So the scarier thing I would think is the long-term uncontrolled hypertension that you may have had, or you've just dismissed from your doctor, because the sad part is you've probably gotten used to living with high blood pressure and elevated, and so it feels normal even though it's not to you. And then sometimes normal blood pressure can feel abnormal once you get it under control. But we've all heard this term, Dr. Bhatia, of like, you need to stop before you stroke out. So can you get so hyper vigilant that you have you're like stress, anxiety, like in a tense moment? Can that cause a stroke?
Yeah, that's a good question. So when we talk about stroke, it's really important for a patient, of course, themselves, and also for the caregivers, the family, to recognize some signs and symptoms which could be concerning for a stroke, or at least demands that you call 911 and go to the nearest emergency department. And the easy way to remember is by an acronym called BFAST. So B stands for balance. So if somebody has any sudden onset dizziness, or they're just wobbly, or they just don't feel right with the balance, that could be a sign. E stands for eye. So if you have suddenly lost vision in one eye or both eyes, or you just started seeing double, that could be something concerning. And F stands for facial. So if you've started feeling numbness or weakness on any one side of the face, or somebody around you notices that your face is suddenly asymmetrical, it's just droopy on one side, and you're just drooling from one side or one corner of the mouth, that's concerning. A is for arm. So if your arm just suddenly becomes weak or numb, that is a warning sign that you having a stroke, or you just starting to have one. And T is for time, most importantly. I think I missed S. S is for speech. So anytime that you feel that your speech is abnormal, which could be just simple as missing words, you're just not understanding anything that people are talking around you, or you have a chain of thoughts, but you just cannot get it out, that's a speech problem, and that could be a sign of stroke. And the last is the T, which is time, and it's very sensitive that you recognize and then call 911. I cannot emphasize more that recognition of stroke is very important, and it's very time sensitive. So every minute that passes by with your brain not getting enough oxygen or blood, it just predisposes your brain to lose that amount of function, and very less chances of recovering it back. So that's why time is very important to recognize and seek help.
And that's why this conversation today on good things to me is so important, because there's a commercial going around, Dr. Bhatia, and I can't think of who puts it out. It's probably someone connected with Stroke Association, if that's a thing or whatever. But the guy is like talking in his head, and someone's asking him all these questions, and he's like, I'm having a stroke. I'm having a stroke. And so sometimes those that they can't really verbalize it or get it. But if you recognize it, if we're all sort of keen on what be fast means and can spot it and not allow that person to blow it off, or to just, because I think that's what we do here in the South, specifically men and women. We just make excuses for our symptoms when that time is so important that we just need to go ahead and check it off the list. If it's not, it's not, and that's great. But then if it was, we can get seen about.
Yeah, that's actually correct. So we hear this so often, actually. Patients sometimes start feeling something abnormal about their body on one side, or their face, or their hand, their arm. And sometimes at least the general response is to sleep over it, thinking that these symptoms will go away with time, and you're just having an off day. But actually, most of the times, it turns out that those were your stroke symptoms, and they just taught it, and you just didn't recognize it, or didn't seek help or raise alarm to come to the closest ED.
Now, I know when you have like a massive stroke, that's like really you need to get to when you're at the hospital, there's like things to do. But if you feel like you're just having a stroke, but you're really not sure because you're still kind of functional, but you still don't feel right, when you get to the hospital, Dr. Bhatia, what are they going to do to help you? Like in that time-sensitive moment, can they stop a stroke, or are they going to be able to just monitor you? Like, what are they doing?
Right. So the priority for anybody who's having stroke or concerns of stroke comes to the ED is to get them in, check their blood pressure, take a good history, and get them to a CAT scanner as soon as possible. Like we were talking about in the beginning, it's very important to differentiate the two kinds of stroke, the clotting kind and the bleeding kind. Because if patients come to us within a specific early time period, up to 4.5 hours, there's actually a therapy. It's called clot-busting therapy, or a TPA, that we can offer once we've ruled out all the bleeding risks in clotting kind of strokes. So that's why it's imperative to reach to a hospital as soon as possible, so that we can rule out your bleeding risk, we can rule out other risk factors that may be causing you a stroke, and if you're within the timeline, we can offer you this clot-busting medication.
If you've had a stroke once and obviously survived with minimal lasting effects, what's the likelihood that, are you now at like quadruple high risk of having another one?
Yeah, so that's a good question. So you are definitely at a higher risk of stroke as compared to the general population. So as a matter of fact, close to 800,000 Americans have stroke in a year, but 1/4 of them are recurrent stroke. So there is a 25% chance that you're going to have another recurrent stroke at some point in life. So it definitely raises your risk. But I think vigilance, control of your risk factors, and just knowing what your body has gone through before your you're very likely that you're going to recognize your second set of symptoms. And that's what we usually talk about in stroke prevention.
Which we will get to next here on Good Things with Dr. Bhatia station. And today on Good Things, we're continuing our conversation with Dr. Bhatia. He's Assistant Professor of Neurology, Clerkship, Co-Director at UMMC, and he's helping raising our awareness about stroke. And that's pretty important because, Dr. Bhatia, I know you just said, you just told me in the break you were looking at some numbers in terms of Mississippi, but where are we on the list of stroke incidences?
Yeah. Recently, as per the most recent numbers, until 2020, stroke was actually the 7th leading cause of death in the state. And now, as per the latest 2021 CDC data, we are on the number 6 cause, with stroke being the cause of death. So we are definitely on the higher rank when it comes to stroke deaths. And majority of that is just because the risk factors amongst Mississippians is just a little on the higher side, especially with the blood pressure, cholesterol, diabetes. And in total, they do add up to your cardiovascular diseases and mortality, and stroke being one of them. So, yeah.
So what I'm hearing from you, though, I was hearing blood pressure. And if that is the one thing you could focus on today, if you don't take away anything else from our conversation here on Good Things, would be focus on your blood pressure and managing it in whatever way that looks right. And then you're going to decrease your risk of stroke tremendously.
Yeah, I think the numbers really matter, and that's what we encourage our patients to keep a track of their numbers. Maybe just a diary that just records your blood pressure once every day. Keep a track of it when you go to your primary care doctors to discuss. But one thing I think our listeners that need to be aware about the magic number that they need to figure out on their blood pressure, it's 140/90. That's the number that you need to be below to manage your blood pressure appropriately well. And it becomes really important to just be in regular touch with your primary care doctors. If you need a medicine, take it regularly, be compliant with it.
Say that again for the people in the back.
So,
because I do feel like, and this has even happened in our own family with some, and maybe you fall into this, and that's not poking fun, but with great respect, even if your blood pressure is good one day, it's not like Tylenol or Advil that you take if a pain occurs. You have to take that consistently, or it doesn't work consistently.
Right, and that's well said, actually. So it's just not one number one day. It's the history of long-standing blood pressure that actually contributes more. Of course, the spikes matter, and that can tilt the balance towards the negative side in a patient who's just had a blood pressure long history. But one fine day, if your number is good, that doesn't mean you stop your medications acutely and you think that your numbers are under control, so you don't have hypertension anymore. Your dosages may need to be adjusted working with your primary care doctor, but you should not stop your medication.
And that's a wonderful thing. If you make those changes in your lifestyle that lead to an improved blood pressure naturally, that is like high five hugs. And so, yes, you may get to back off and hopefully be able to alleviate having to take any, but that is a conversation you should have, with your doctor for sure. Okay, Dr. Bhatia, there's another sort of word that goes around is these mini strokes or TIAs. So we think of the massive strokes, and those are super scary, and they come on quickly, and then they're very obvious. But it's the mini strokes that kind of lead us like not as scared in our pants, I think, as we should be.
Yeah, so mini strokes, the more clinical word is the TIA or transient ischemic attack. And I usually refrain from using the word mini stroke just because sometimes people think it's a mini stroke, so it's just a minor thing, it's a milder thing, and things will get better with time. But it's just your transient stroke symptoms. So it's the temporary blood flow that's getting blocked. So your symptoms are transient. But that's the hope, that they remain transient or they recover. You don't know at that time whether this will develop into a full-blown stroke or your symptoms will resolve. So that's why even TIA is a medical emergency. Means that as soon as you're having any symptoms which could be concerning for stroke, if you remember the acronym B FAST, irrespective of how long they've been going on, as soon as you recognize, you need to come to the closest emergency department or dial 911 to get you to the emergency department. Um, it's good that the TIA sometimes resolves within minutes or seconds, but what happens is such patients are actually at a higher risk of having stroke in the next 90 days. And the highest risk amongst those 90 days is within the first 48 hours. So that's why it's important to seek medical help. We may be able to see what's causing your transient symptoms, and we may be able to offer help in correcting those risk factors or get you on a heart rhythm monitor if it's the cardiac arrhythmia that's causing it. So even if it's minor, doesn't mean that
something major is not headed around the corner. And what are some of those treatments? I know when people start hearing treatments and all, it can be what are risks, what are side effects that can keep them from coming. So what are some of those when they come in, Dr. Bhatia?
Right. So I usually divide them into an acute phase, which is what we talked about. If somebody's having a clotting kind of stroke and you come within the first 4.5 hours, and if you don't have a bleed in your brain, and if you don't have other bleeding risk factors, we can offer you a clot-busting medication. Of course, individual patient scenarios will change, and not everybody may qualify, but it's still an option, which cannot be ruled out until you come and get evaluated. After the acute phase comes more of a period where you maintain things and you prevent things. So control of your blood pressure. If you've had a clotting kind of stroke, you need to be on an antiplatelet therapy. There are certain options, and then that again goes with going over your individual risk factors and tailoring these therapies as per your needs. Most common is the aspirin that we keep talking about when it comes to heart attacks. So that's a kind of an antiplatelet therapy. Controlling your blood sugars. It's really important to manage your blood sugar even in the acute period, because higher blood sugars have shown that your stroke outcomes can be bad, because your stroke may progress, may get bigger. So it becomes important to control that too during the acute phase. Cholesterol is something we really emphasize on, and we do use some cholesterol-lowering medications. Most common is the atorvastatin, or it's also known as the Lipitor. A lot of patients with heart disease are on it. These are the big risk factors that we control in the acute setting and going forward. But ultimately, one of the other factors that you need to control as far as prevention is concerned is your maintaining an optimum weight, exercise, diet, smoking. Even though it's more of preventive, but every time we see a patient in the hospital or also in the clinic going forward, we do encourage and we re-emphasize about the importance of controlling all these things.
You've given us a lot of good information today, Dr. Bhatia. If someone is struck by this, but that may not be the right terminology, by it, or at least convicted, or just feel like they have some concerns or would like to get connected with a doctor to follow them precisely for this, do they go to their primary care? Do they come to a stroke specialist? Like, what's the next step?
Yeah, so once the acute period is gone, I think it gets really important to follow up with a stroke doctor or a neurologist even. The long-term care depends on basically a collaborative effort between your primary care doctor and a neurologist. A neurologist is going to monitor how much your improvement is happening with certain scales that they can measure the functional outcomes with. And that goes hand in hand with controlling the other risk factors that you have. That's why the importance of following up with your primary care doctor becomes important. So it's not a one-man show, it's a team effort. Depending on your stroke deficits, we often actually refer people or collaborate with physical therapists, occupational therapists, speech therapists. So again, it's a very multidisciplinary approach when it comes to management of stroke.
And there should be no sense of guilt or shame or anything around if you've had one or if you feel like you're at high risk with one. Today's conversation is all about raising awareness, because if we want to prevent them. We want you to never have one, right? And then if you have, we want to make sure that you're taking care of yourself to the point that you don't, and then also knowing that be fast so we can take care of those around us. Dr. Bhatia, if we want more information on you or your clinic or wherever you're at, how do we get that?
Yeah, so all the information, I think, is at the UMMC website. And of course, there's numbers. There's my. I don't have a personal clinic, but I work with the hospital majorly. But yeah, I think it's important to, if you're having acute stroke symptoms, to dial 911, come to the emergency department, and if somebody's had a stroke and they need a stroke follow-up in the clinic, in the neurology clinic, your primary care doctors can work and send referrals to the stroke neurologist in the community.
Balance, eyes, face, arm, speech, time. I did it! I passed the test, the Be Fast, and it works, and we can all take care of one another, which I think is such a good thing. Dr. Bhatia, thank you for your time.
You're welcome.
All you're doing here in Mississippi to keep us healthy. And you guys stick with us. We got more for you coming up.